So if you just give it a few seconds. You're live now, Councillor Corser.
Good evening, everyone, and welcome residents and stakeholders to our first virtual Aston Ward Forum meeting. We have decided to hold virtual meetings during the lockdown because of the COVID-19 pandemic, due to give you the opportunity to get important ward updates and to answer any ward-related questions and queries that you have. Please use the question and answer facility to ask any questions that you might have, and we will try to answer them. If you are unable to answer them during the meeting, we will come back to you outside of the meeting. And if you could leave your email address, please be patient and bear with us as we are learning together. The code of conduct was also sent for the meeting, with the invite and the agenda. And I must advise you that the meeting is being recorded and will be available for future record and viewing via the Council's YouTube channel. Thank you. If I turn to the agenda, notice of recordings. The chair of the meeting is to advise residents and participating listening to the online meeting that recording of this meeting will be available for future record. The COVID-19 update, which is the third item on the agenda, and I have Rachel Chapman from Public Health Register. If I could welcome Rachel, please. Thank you.
Thank you, Councillor Corser. So I'm here for Justin Varney, so apologies he couldn't be with you this evening. So I'll give you a brief update on COVID across Birmingham and also where I've got some local data for you. I'm happy to take questions. If there's any that I can't answer, I'll take them away and see if I can find out more information. So to start, in terms of the update in COVID rates, we are seeing the rates slowly coming down across Birmingham. Currently, our rate is at 584 per 100,000 population. This is in comparison to the national rate, which is 372. So you can see we are still quite a lot higher than the overall national rate. And while our rates are coming down, which is good news, it is quite slowly and more slowly than other parts of the country. So this is certainly something that we are keeping a very close eye on. If I can just put those numbers into context a little bit, at the start of December, at the end of the last lockdown in November, the rate actually dipped just below 200 per 100,000. So at 584, we are still a lot higher than we were at that point in time. And then when we came out of lockdown at the end of November, the rates only stayed low for 2 or 3 weeks before they started to climb rapidly again just before Christmas. This actually is a pattern that we are seeing across the West Midlands. So other areas in the West Midlands also have high rates, particularly Sandwell and Wolverhampton at the moment. If you can just bear with me, I do have a separate document where I can give you a little bit of information specific to Aston. So as I say, in terms of Birmingham as a local authority is the 18th highest in England. When we look specifically at Aston Ward, the ward ranks joint fourth out of the 69 wards in Birmingham for the number of COVID cases. So where first is the highest, so a high number of cases. If we calculate rates, which so taking into account the size of the ward, the rate for Aston is 630 cases per 100,000, which is above the average across the whole of Birmingham. And Aston rates 13th out of the 69 wards. So we do have high rates in this particular area. We're able to do a little bit of digging into the data to see what we can see about the pattern of cases. And over the last month, more of the cases are in our 20 to 39-year-old age group, so our younger working age population. So that's the age group where we've got more of the cases, that's 44%. And then the next age group, where we've got 29% of the cases, is the 40 to 59-year-old age group. And this is consistent with the pattern that we're seeing across Birmingham, where the majority of the cases are in working age adults. The other pattern that we're seeing, and again consistently across Birmingham, and we also see it within Aston, is that we do unfortunately have proportionately more cases in our ethnic minority groups. And in Aston, 68% of the cases in the last month were in the Asian group, 10% in the black group, 5% in the mixed other group, and 6% in the white group. So that's just flagging up your local data. If I then sort of come back to the more general picture in terms of Birmingham, as I said, the transmission, well, the highest number of cases is in our working age population. So we think a lot of this transmission is through social interactions. We're also obviously keeping a very close eye on workplaces, because recognising that some people do still need to go out to work, they're not able to work from home. And then we're also asking people to think about things around that. So, for example, getting to and from work, are they car sharing? Are people just sort of congregating on the way into work or at lunch times? Because that is when we're getting transmission of the virus. It's sort of when people just let down their guard a little bit. The other thing, if I could just pick up, I think particularly with this new variant, because we know it's more transmissible than the previous one, that once somebody picks up COVID, often the rest of their household will also pick it up because it transmits so easily. So if I could just run through a few key quick messages about trying to reduce the risk of spreading COVID at home. So obviously we know that all household contacts should be self-isolating, but where possible at home, and I'm recognising this isn't always possible, but where possible, if somebody has got COVID, that they should try and limit contact with the rest of their household. So not spending a lot of time in shared spaces like kitchens, living rooms, that sort of thing. And if that's not possible, then try to keep 2 meters away. If possible, wear a face covering. If you can, even if it's only for a short time, open the windows, get some fresh air through. Anything to try to stop that spread within the household. If you can, eat in a separate room, recognising obviously this has a big impact on people's mental health and well-being. So this advice certainly isn't given lightly. And then in terms of bathrooms, if it's possible to have a separate bathroom, then that's great. I know that isn't always possible, but try to have separate towels. The person with COVID use the bathroom last, clean it after you've used it. So all of these things, just little things all of the time to try and stop the spread at home. We are continuing to see pressure on the NHS. As I said, at the peak in terms of cases in Birmingham, looks like it was a couple of weeks ago, but then we always see that lag in terms of the NHS and the impact on the NHS, because it's often 2 or 3 weeks after people have caught COVID that if they're going to become ill, then they become very ill, and then they might need admission to hospital. So that's why we're seeing this huge surge in activity in our hospitals at the moment. Sadly, alongside that, and I know it's been like very much in the news today in terms of the deaths, we also see that lag. So a few weeks after the peak is when, unfortunately, we will probably see more of the deaths. If I can just go through then to testing, there are, for COVID, we've got 2 different types of tests. We have the PCR test, which is the one that's been around the longest since the summer, and more recently the lateral flow test. Both of them, they need a swab. So it's a swab up your nose and down to the back of your throat, which I understand it is not particularly, it's not particularly pleasant, but over and done with quite quickly. But they're both the same for that. The PCR test is for people who've actually got symptoms of COVID. And this is the one that you book through the NHS. We've got 10 walk-in sites and 2 drive-in sites in Birmingham, but you need to have an appointment to go to these. They take the sample and then it has to get sent off to the labs, and you get the results a day or 2 later. The other type of test is this newer test, which is called a lateral flow test. And again, it's a swab test, but this is the one that can be done on the spot. So once the swab's taken, you mix it with some solutions, and it then gets put onto it. Justin talks about it as looking like a pregnancy test kit. So it's basically a slide. It has lines on, and the line comes up as to whether it's negative or positive. And this is what's being used for people who don't have any symptoms, but we're really targeting its use at people who are very much frontline in terms of the workforce. So people who have to be in work and are at risk of picking it up and at risk of spreading it to others. Lateral flow is a bit different to PCR because the test is picking up different things. Lateral flow is more likely to pick up COVID if you are infectious. So if you're carrying more of the virus, and you're more likely to be infectious to other people. And this is where it's particularly useful because we are finding people who have got COVID and haven't got any symptoms, so they're not aware of it at all. And what it means is by doing the lateral flow, we can give them advice on self-isolating at a much earlier opportunity, so they're less likely then to spread it to other people. So we're finding the lateral flow is very useful for this, and we're looking to increase the availability of this more and more in Birmingham over the next few weeks. At the moment, anybody can get a lateral flow test through the NIA, and this is walk-in. And I'm told that it's running well, that there are very few delays. We do have mobile sites and community venues. Now, the mobile sites we move around according to where we feel we've got the greatest need for testing. We also have some pharmacies coming online. So we've got over 30 pharmacies across Birmingham now offering it, and more coming online. And all of these are on the Birmingham website, Birmingham Council website. So if you just search up Birmingham lateral flow testing, it tells you where they are available, and you can book an appointment at any of these. So apart from the NIA, you do need an appointment. In addition to this, we are setting up workplace spokes in set workplaces, and also looking where we have services for vulnerable adults, so that we can test perhaps the staff and the adults where that's possible. So that's in terms of the picture for testing. I think the other big thing to flag up is in terms of the vaccination. This programme is being led by the NHS. Obviously, they've got great experience in terms of mass vaccination programmes, running the flu vaccination every year. This is the COVID vaccination programme is obviously unprecedented in terms of size, but they're building on all of the expertise they've already got. In terms of rollout, the West Midlands and Birmingham, we're doing pretty well in terms of getting the vaccine out there. We've got good uptake in our target groups, initially targeted at our care homes and the people working in care homes. And the key message here in terms of the vaccine is it's being used to prevent serious illness and death. And that's why it's been targeted to these groups, because this is where, unfortunately, we've seen the most serious illness and death. So the NHS have been working hard across all of our care homes, and I think we're nearly there now in terms of the first dose. And now moving to the next category down. So over 80-year-olds, over 75s, over 70s, and clinically extremely vulnerable. In terms of vaccination, you will get called for vaccination. So people will be called by their GP and told what to do and how to get the vaccine. We are aware that people were actually getting invites through two routes, one through NHS England and one through their GP. And the advice, and if people are still finding that, just take whichever one comes first, whichever one works for you. To be honest, I'd rather people were offered it twice than missed it. So I think that system's been ironed out, but there was a little bit of confusion at the start. However, it's really, really important message with the vaccine. The vaccine, as I say, is about preventing serious illness and death in the people who are most likely to be ill from COVID. it is still really important when people have had their first dose of the vaccine that they still follow the hands, face, space guidance, that there is still social distancing, that they still follow all of the lockdown guidance, no mixing between households. And this is because we've still got high levels of COVID in the community. It is still spreading. And with the vaccine, whilst the vaccine is very good at preventing serious illness, you might still pick up COVID. And what we don't know at the moment with the vaccine is how much people can still spread it to others. So this is why we're saying it's so important to please, if you've had the vaccine, great, but please still follow all of the guidance at the moment. If I could then just move on to COVID champions, I want to do a bit of a sales pitch here, if that's all right. Across Birmingham, we've been developing our COVID champions. And these are members of the community. This can be anybody in the community, so community leaders, but anybody who's interested. And we're asking them to sign up to be a COVID champion. And by doing this, it will basically empower them and then others to be able to stay as healthy as possible during the pandemic, so to stay safe, to stay healthy, and they will be able to share all this information on topics about COVID, including the vaccine, all the current things that are going on. So people who sign up will get useful and reliable weekly updates. We know unfortunately, there is an amount of misinformation out there. And by having COVID champions, what we're able to do is make sure we're able to push out reliable information. So any changes to local or national guidance, new service announcements, new updates on how to stay safe, all of that sort of thing. Our COVID champions are invited to exclusive webinars with topic experts. We've done a series of these, and they've gone down very well. And they'll also have the ability to ask questions directly to the public health team. It's very much a two-way exchange of information. So us sharing the information with them, but also information coming back on messages they're picking up, any challenges that they're finding. By signing up, that there's no firm commitment. It's just about receiving the information and sharing it with whoever they can. Now, we have in Birmingham, we've set a target of having 1,000 of these across the city. So far, I think this week we're up to 589, which is brilliant, and they have been brilliant so far, but we're aiming for the 1,000. In Aston, we have 3, which is great, but we urgently need some more. If we share the 1,000 across the city, we would like Aston to have at least 21. Be fantastic to have more than that. There is no limit. So urgently, we'd like to see at least 18 more. So I've been basically asked to sort of highlight this as a bit of a call to action across the ward. And anybody who is interested, there's information I might be able to post. Perhaps Kay, if I can share the link with you, I might be able to post it in the chat. You just sign up online. So that's my sales pitch, but we'd love to have some more COVID community champions from Aston. That's it in terms of my update. Are there any questions?
Before we go on to question answer, can I just ask if all attendees can please use the chat facility as well, just in case there's some questions in the chat, please.
Excuse me, sorry, Councillor Cole. So there aren't any questions in the chat at the moment.
That's fine. Councillor Afzal, do you have any questions?
Yeah, I would just ask Rachel that in terms of vaccination, I just want to know that where Aston stands in terms of the supply of vaccine, and is it available with all the GPs in Aston or not? Because people are still confused, and in some cases they haven't received letters, even these top priorities, over 80s, over 75s, over 70. I mean, my understanding is that sometimes the idea is that even from 50 plus people can have these. But I think that still there is no sort of very programmed organization that how many people have been vaccinated and what percentage has still to be vaccinated. I mean, considering that we have got one of the highest cases of positive, there is a need, more need actually in Aston, that more people should be vaccinated, especially in those top 4 categories.
Yes, so in terms of the information, I have to say I do sympathise with the NHS a little bit on this, in that the data system to collect the information was updated a couple of weeks ago. So they've been starting to collect the information into the new system, but this is all held nationally. So at the moment, we don't have direct access to that within the council. So we're working with our NHS colleagues on getting the information back out so that we can start to understand the pattern locally, to understand who's had the vaccine. I'm also, well, obviously we're also interested in people who haven't had the vaccine so that we can start to understand what any issues might be and what we can do to encourage that. So I can't unfortunately give you specific data for Aston at the moment, I'm afraid. Hopefully we will start to get more specific data through, but we haven't got it yet.
Is it possible to know, because not all these surgeries have got vaccine. Some have got quite well in advance, 3-4 weeks ago, and some are still waiting. I know about one which was promised, and then every time when the delivery was due, they told even their patients were there, but then the delivery of vaccine never came. And then they were promised another date, and again on second date, vaccine was not delivered. And even on third date, it was not delivered. So I just want to know that is now the system has been improved, because people are still not being vaccinated in the top 4 categories.
Councillor Afzal, if you're able to share with me outside of the meeting the specific surgery, I can certainly ask NHS colleagues to look into that.
Yeah. Okay.
I know obviously the supply of the vaccine, we know from national news, we're using across England, we're using the vaccine up as quickly as it's coming through. But if we've got particular areas where they are really struggling for supply, if you let me know, as I say, I will absolutely feed that back to the NHS through my routes that I can do that.
Thank you. Now, another question, is this vaccine being supplied to every surgery, or it is being supplied on the basis of grouping, that they made up groups of 4 or 5 surgeries, and then they got one point where they are being vaccinated, people are vaccinated, or is it being delivered to each and every one?
In terms of the very local arrangements, I haven't got visibility on that. The vaccine is being organised through, as you say, the groupings of GPs, the primary care networks. So each primary care network is looking itself at how it organises getting the vaccine out there. So that's where it would be useful that if we are aware of some issues locally, we can take those back and flag them up. But it is through, you're right in that it's through the primary care networks that it's being organised.
Thank you.
Oh, sorry, Councillor Cowser, you're on. You're on mute.
Sorry, I've just got one question. You know, you were saying regarding the lateral flow test, the one like a pregnancy test. How effective are these tests? And what's the take up of them?
So the effectiveness it varies, and there are a lot of there are several factors that are involved in that. First of all, we know that they are better at picking up COVID where you've got quite a lot of the virus. And this is where we say it's a test of infectiousness. So where you've got quite a lot of the virus, they are quite effective. The tests are quite effective at picking it up. If you've got very low levels, then not quite so effective. But actually, as I say, because we're using it as a test of infectiousness, that works well. As with all tests, the effectiveness is also down to how well they're carried out. So how well the swab is done, and somebody from Public Health England has described it as basically trying to tickle your brain and tickle your tonsils, but really that swab does need to go right up the nose and into the throat to be able to pick up the virus, and that's the same for the PCR test as well as the lateral flow test. And then there's also the carrying out the test. So people who are doing the test obviously go through a good training programme to be able to do that, and then we also have some quality assurance steps in along the way. But I have to say there is no test that is 100%. So what we find, we are definitely picking up cases that we didn't know about, which shows that it is valuable. However, if somebody has had a negative test result but they start to develop symptoms, it's absolutely vital they go and get tested again. So a negative test result doesn't mean that's it, you're completely safe, and it certainly doesn't mean that you should drop any of the measures to stay safe from COVID. Everybody still needs to do all of those, even if they've got a negative test result.
What's the take-up of this test like?
Building, I think it's fair to say. So we have been using it for, I think it was during December. It was made available to our staff and residents in care homes, and we are rolling it out through the community. And each week we're looking to improve the availability of it, the number of tests that are done, and the uptake of it. And certainly at the moment there is capacity in the system, so if people want to get tested they can go and do that, and we want to increase that capacity.
Because to be honest, I've just heard about it from yourself.
Okay. So
what are you doing to empower people with that knowledge, and where can they go to get the information about this test?
So we have a whole, there is a whole communication plan. There's a team working on communication. I will take back to them because it's interesting. I find when somebody says to me they haven't heard about it, then obviously that is in terms of communication. We are very much at the moment targeting it at, whilst it is available to anybody, we're targeting it at our frontline key workers. So a lot of the publicity has gone out through those routes, and perhaps less so to the general population. But I will take that back because that's always useful to know.
That's fine. I don't have any more questions. Councillor Avza, do you have any more questions?
No, thank you.
Oh, can you share the link for Call Champions? Oh, also, Rachel, I think there's a question on the link. If you can share the link for the COVID through for the champions on this, please.
I certainly can. I don't know how to do it on the live Q&A. Making an right. Thank you. Learn something every day. Now then, will it let me copy it? Sorry, if you could just bear with me as long as I can copy it across.
There's also a question from a member.
I'm sorry, it's not letting me copy the link.
Okay. If you look on your toolbar, there's a you know where the telephone line red box is. Next to that, there's a chat with a question in it. Question mark. If you click on that, the live chat question Q&A will open on your screen. You can type it in that.
Okay, let me. Sorry, I'll just have to refer back to it. Shall I type that in while you move on to the? Yep.
There was a question from Mark, one of the chairs of our resident associations in Aston Ward, and it said if you have no symptoms but you are a key worker, like in a supermarket, can you get a test done?
You can go and get one of the if you haven't got any symptoms, if you would like to go and get a test, you can go to the NIA or book in for one of the lateral flow tests. We are working with some of our workplaces in terms of rolling it out, so it's actually available in the workplaces. I haven't got a list of which ones yet, but it will. Some of our employers are actually taking up the offer, so they have the lateral flow tests available in their workplace, so they can test people regularly when they come to work. But if anybody who wants to go and get one, as I say, can either go to the NIA or can book in online for one of the other venues.
I believe there's no more questions, and I think myself and Councillor Afzal have no more questions.
Okay, in that case, I'll just finish typing into the form. But if you think of anything else, please just send me an email.
Yeah, that's fine.
Yeah.
Thank you for your time.
Thank you, Rachel.
No, thank you very much, Rachel. Thank you.
For that. Item number 4, we have Liz Parks to give us an update on the library in Aston. Thank you, Liz. We have Liz with us.
Good evening, councillors. Thank you for inviting me along. If I just can add that, unfortunately, I don't have a camera on my laptop, so it is only an audio. So I've tried to put some slides together rather than just looking at my initials. Thought that might try and be a little bit more interesting. So I'll try and share those with you now. I'm hoping that some slides have just come up. Can you see them?
Not quite yet, Liz.
We can just, yes, we can.
Are they there?
Yes.
Yeah.
Yeah, perfect. Okay, thank you. So I've come along tonight just to give you an update on Aston Library. I shall run through I've got a few slides just with a bit of history, and then obviously I can talk about the situation that we're in now that obviously has had an impact because of the coronavirus pandemic. So I can't really see you at the moment, so please do shout if you want to stop me, because I'm reading from the slides. Okay. So just as a brief history to the audience that are listening, there was a cabinet decision in 2017 regarding the future of community libraries within Birmingham. And from that, there was a concept of tiering libraries. And within that, we had an agreed cabinet paper agreed on the 14th of February, so that's 2017. And that saw the service being aligned into what we call our new tiered model. So there are 4 different types of tiers. And the first tier is sort of our main larger libraries, and they are open for 35 hours a week. They tend to be delivered from their current library building, and there are 19 libraries in that tier 1 category. Then we have our tier 2s, which are open for 21 hours a week. They do differ on days. They tend also to be delivered from the current library building, although in some sites we have been able to increase the 21 hours by working with partnership organisations. So an example would be Perry Common Library, which isn't that far away, and we work with Whitton Lodge, and obviously, sorry, a lot of this is pre-COVID. Whitton Lodge would work on a Friday to enable additional access to the library service for the community. Within our tier 2 model, there are 10 sites that operate as such. Then we have something called a tier 2/3. We have 2 libraries in that tier, and they're staffed for 21 hours, but we tend to work with community or organisations locally to make those solutions sustainable. And again, sorry, I'm referring to pre-COVID. I feel like I'm talking about a different time. I think the last 12 months have been so different for us all. Glebe Farm Library were able to open 7 days a week with the support of the community and different organisations. But again, unfortunately, this work is paused at the moment. Tier 3 libraries, and Aston Library falls under what we call a tier 3 library. And again, we look to run with community organisations if possible, and we work with a partner if there is one available within the area. The library service offer a 15 hours library assistant post, and we provide the books. We've invested in self-service within the equipment, and there are 5 sites within that category, Aston of which is one, and up until our first lockdown, Aston library was provided from Aston Adult Education Centre, that I think most people are familiar with. I'll just change slides. Sorry, it's getting a little bit slow. So again, pre-coronavirus pandemic, the site was currently, as I've just mentioned, at the Adult Education Centre. We did have some limitations in that the library area was only accessible during the week after 3 o'clock, when the learning day for the adult learners was over. So those current hours between 3 and 4:45 on a Tuesday and a Friday, and then a 9 till 5 just closed for lunch on a Saturday. But when you total all of that together, it's only 10.5 hours. So we were aware as a service that we were having a shortfall of 4.5 hours on what our Tier 3 offer is. If you visited the library within the Adult Education building, all visitors are required to sign into the library space, and they need to wear a visitor's badge during their visit. Unfortunately, just due to pressures on the Adult Education Service, they weren't able to support the library offer in an unstaffed mode to enhance that 12 hours. Okay, just change slides again. Therefore, we then started to look at different sites which were local to Aston that we thought may be able to help us develop the provision of the library service in the way that as a service we wanted to see, and that was to offer 15 hours or extend it. And we found that by talking to Aston Fire Station and their very exciting remodelling along with their heritage group, we felt would give us that opportunity. So we're looking at the proposed library site within the fire appliance bay. There's also a community room there, which will be free of charge for community use, an opportunity to work with partners to maximise access and minimise costs. And there was also within the plan the provision of a community cafe area. For the library service, it's very exciting to be working with the heritage volunteers. As I'm sure you're aware, the collections that their heritage volunteers sort of look after is of national significance. And I think when we look at what the fire service have managed to provide within Eastside, you know, it's a really exciting opportunity. So after all that enthusiasm, and then unfortunately COVID-19 came along, which has rather halted our plans, unfortunately. So at the moment, we're in a position that the library service isn't able to offer any open service to the public, although I am pleased to tell you tonight that we are starting what we're calling a books by post service from next week. The Library of Birmingham have launched it this week, and community libraries will be offering it from next week. So we are hoping that we'll be able to at least start to provide citizens with reading material. Through lockdown, we have been working very hard to put, we have a YouTube channel, a library's YouTube channel, and we have been trying to put a lot of social media content out. But obviously we are not delivering a library service as we'd all choose to if, you know, times were different. So I'm hoping these next few photos that I can share with you, you're going to get a little bit of a taste of what the space looks like, as we're hoping to we'll be moving in and accommodating it in the near future. So the first photo here is as you just come into the library, and that would be looking out onto the main road. So that is a sort of there's bay windows. If you've been into the fire station before, that was offices, but that's been opened up now, and it's a lot, as you can see, lighter and brighter. This area that's better actually. That's a better picture of it. Sorry, that's the one I've just shown you. That's both angles of the room, and this is what we'd call the main library space. And the second photograph, as you can see, it's got the banks for the internet connections along the back, where we'll put banks of computers. Is the plan for the library service there. A really exciting part of the project is that they've kept so many of the uniqueness of the building, and obviously a fireman's pole. Who doesn't love a fireman's pole? Really exciting. This will be within the children's area, and we just think that's a really exciting thing for the children to be able to experience. So this is all within next to the fire appliance bay, and again it's sort of the large window which we would share with the appliance bay. So this side would be the children's library, and they'll be able to view a fire engine or a 4x4 vehicle the other side. So I think this is an absolutely completely unique project. And then there's just a visual there with the fire engine there, so you sort of get an idea of what the library space could look like. So as we move to the far right of the screen, it's sort of more of the adult library, the reception area. Then the middle area would be the children's library. As you can see, the pole towards the back, and there's a lift for access up onto the second and third floors, and obviously the fire appliance bay. We're at the point now, unfortunately, that, you know, the project, we were hoping we would have been operating from the building by now. I would say we're about 12 months behind where we would like to be. There was a delay with the build, so that would have pushed things back, but obviously with the pandemic, we're just not able to move forward as we would have liked to at the moment. But as soon as it is safe to do so, we will be finalising the lease. All we've got to do now is agree a date of occupation. Everything is ready to go apart from that. Does that give you a bit of an overview? Let me just, if I unshare, if I can. I think I've unshared now. That's, I can see you again now. Sorry, it's so difficult when you're just talking to a screen. But if there's anything you'd like to ask me, or if I covered enough, obviously it's a disappointment that we're not where we want to be at the moment. But we are where we are. We've still got exciting plans, and I really hope, you know, when we are there, it will be an award-winning library. Really, I think it's a unique opportunity that I don't know of any other library that shares a fire appliance bay. So exciting times to look forward to.
Definitely. Councillor Afzal, do you have any questions for Liz?
Yeah. When you think that, I mean, as far as the lease is concerned, it is not possible that in the coming couple of months we should finalize it, because hoping that whenever this downlock would be over.
Everything, yes, Councillor, everything is ready. We just need to give a date of occupation. But at the moment, with library staff, not all working within libraries at the moment. Obviously, we are trying to offer a books by post, and we are looking to supply staff to support the vaccination centres as well. So we just didn't want to be in a position that we, you know, obviously we've taken a lease and that we can't occupy yet. So, but as soon as we are able,
I appreciate, but sometime if we don't have the paperwork completed, it may take once the lockdown is over, and then we start the proceedings to complete the lease, etc. Then it may take another couple of months. So what I think is, while the lockdown is there, we can't physically move into the library, but at least the paperwork should be ready.
I agree.
Yeah.
I agree, Councillor, and as far as I'm aware, it is already, apart from writing the date on that we're going to move in.
Okay then, well, that is a good news then. That is good news.
Any more questions, Councillor Afzal?
Also, that when we move there, can we have the arrangements that at least we will be doing 15 hours and not 10.5 hours?
Absolutely, absolutely.
Yes,
That's great, and I'm hoping it will be more than 15.
There's no point that fire brigade has been very good, and now we got this new place, and Aston is also in a very good place that we have got 2 libraries, although they are part-time, but still we have still got 2 libraries, and I don't know any other ward where there are 2 libraries. I mean, some wards haven't got anything, no library at all, and the others have got only 1. And we are lucky that we have got 2, but I want to make sure that this 30 library with 15 hours, we have 15 hours physically and actually delivered 15 hours. And we should make arrangements now that when it reopens, we should have full complement of staff.
Absolutely agree, and I'm committed to giving you 15 hours as a minimum. I'm really hoping that by working with other organisations, and obviously we've had, started to have conversations, although they've been stalled with the heritage volunteers. But again, there are lots more opportunities to explore. So I'd like to see it open more than 15 hours. So yes, absolutely. Yeah.
Any more questions, Councillor Afzal?
No, thank you.
Well, I have driven past the library, the fire station, and it does look, the building does look immaculate, Liz. I've got two questions in the chat, but I don't know if you can read them. One was, how can residents use the library service now during COVID? And the second one was, is the new library as small as the one room in the old library?
Okay, let me try and answer those. So at the moment, residents can use the library service. As I said, if you go on to birmingham.gov.uk and then go to the libraries link, it will be able to explain. We've got a lot of content online, and also there are a lot of links on how to use the ebook service, so that if residents have got a device that they can download to, you're able to download books onto your device as an audio book, or as like a Kindle as well. So we've got lots of resources that people can use free of charge. As I said, we've got lots of content. So for children, we've got lots of activities, lots of pre-recorded story times. But on our social media, we're doing loads of different live feeds as well. So that's something else to look out for. But all on our catalogue pages through birmingham.gov.uk. I hope that answers that. I did mention books by post. So books by post, again, probably the easiest way is to contact. There is a list of libraries that are participating. Unfortunately, Aston isn't on the list because we're not there at the moment. But if you go onto the website, it will give the list of libraries. Otherwise, you can. There's a link to the catalogue, and then you can put in your request via the internet. And a member of staff will contact you if they need further information. Otherwise, it just gets processed a little bit like if you reserved a book online, very similar. Then the books are taken and they get delivered by Royal Mail. So just like a delivery that we're all ordering everything online now, very, very similar. Citizens can either request individual titles and we will try and satisfy that title, or you can have something what we call a staff pick. And a staff pick is if you contact the library and say, oh, you'd like some books on healthy eating, and then we can supply that by the staff picking to your request, and that would be up to a maximum of 6 items at a time. For the individual requests, we're asking citizens if they can request 3 individual titles in process at once, because it may be coming from different libraries. There's no guarantee that we can supply that stock from just one library. So if it's an individual title request, it's a maximum of 3 in process. But if you're happy just to receive a staff pick, it's 6. If it's children's books, again, you just need to contact the local library, and again, we'll try and advise. And the times that the libraries are open and they're staffed is available on the website. Library staff are also sort of doing a befriending service, so we are phoning our regular citizens that you know come to the library every Monday or whatever, just to check in and to advertise the service. And really, we're just really aware that for this lockdown, it's probably even harder than the March one with the short, dark winter days and the cold weather. So just having somebody to chat to and just see that they're okay. We're trying to do that as well. Hopefully that's answered how to use the library service, I'm hoping. The question about is the library as small as the one room in the old library? It isn't. I think the difficult thing about the other library was the shape of the room, because I know whenever anybody asked me what shape it was, I could never quite describe the shape. It was quite unique. So it is a lot more of a regular shape. It is a little bigger. I'm not saying it's double, but it is a little bigger. But I think the shape will make it far easier for us to furbish. But within the new the refurbished fire station, there are spaces upstairs as well. So I think if we were doing a class visit, there's community visit we could use as well. So I think there's a lot more flexibility, although I can't say it's twice the size as what it is, but it's certainly more of a normal shape. Does that answer those questions? Does that help?
That's helped a lot. Liz, you know the first question was about library services. Is it possible, I know you mentioned about a website or a link, is it possible for you to post a website on here? Because I want these virtual ward forums to obviously be a place of knowledge so people can get information if they want to know about how to access library facilities or services. Maybe they might see a website which has already been posted and they can all go onto this website. So is there a website you can post?
It's a Birmingham.gov website, so I'm sure, I'm not sure if I know how to post it on here, but I'm sure Kay will know how to.
Councillor Corser, I've put it into the box. It's birmingham.gov.uk and then search for libraries.
Okay.
Okay.
And we've had the library side. Any you know the community room, because a lot of people residents have asked about this community room. Do you know anything how big it's going to be or how roughly the capacity of it?
I don't know the capacity because I expect that will probably be decided by the fire risk assessment, so it's in the right building to have that happening. So I don't know what the capacity is, but it is on that first floor. So I think the fire service will be able to explain to us. It's Mark Burston, who's the project manager. I don't know if you've met Mark.
Yeah. I don't have no more questions. Councillor Afzal, do you have any more questions?
No, thank you. Thank you, Liz.
Councillor Corser, there's just one extra one in the box. Somebody's asking, can Aston residents use books by post from a library out of their area, Liz?
Yes, absolutely. The only thing that we ask is that residents pay their council tax to Birmingham. So obviously if you live in Aston, that's fine. So yes, you can contact any library because it's done via the website, and then the requests get allocated out to where can satisfy that request, if that makes sense. So for citizens, as long as you live in Birmingham, just pop your request in, and then the library that's most appropriate to fulfil that request will then send the book to you. So just because Aston Library isn't open, that's not going to prohibit anybody from taking part. Please get in touch with the library service. We've had some great new stock and we're desperate to get stuff out to people.
Liz, you mentioned that you can order books and they could be delivered through Royal Mail. Is there a charge for that, or is it free?
No, councillor, it's free. It's free. We just need you to live and pay your council tax to Birmingham.
That's fine.
That's the only requirement.
That's fine. I think with that, we're done with this item because I don't think we have any more questions. No, Councillor Afzal?
No, I agree.
Thank you, Liz. Thank you very much for the update.
Thank you, councillors.
Thank you. With that, I'll move on to item 5, an update on the councillors. Councillor Afzal, do you wish to say anything?
Well, basically, it was a very difficult time, and I think all the residents have actually suffered due to COVID, and obviously their normal activities have been curtailed. We try to help the residents as much as possible in terms of our telephone number, mine, as well as Councillor Gina Kausar mobile phones were available. And a lot of people have contacted us during the COVID, and we have tried to help them. And also we have tried to help the food bank. And I know that there was some difficulty to set up the food bank in Aston Park, and we helped to set that food park. And similarly, there have been food banks in some mosques, and we also helped them to set up and also give them some details of those vulnerable people who were not in a position to have food. So mainly it was the activity relating to COVID and also to the problem. And obviously, like any other residents, it was also not possible for us to go around physically and visit people during this period. But our mobile phones are available, and a lot of people have contacted us on telephone, and we have, both of us have responded them by email or by speaking to them. Thank you.
Thank you, Councillor Afzal. I'll just add to that. We've had, as you may be aware, we haven't been having our advice bureaus, but we have been very busy from home with our casework, because a lot of residents have been ringing or emailing us with our casework. We've also been supporting local businesses that have asked, because obviously they've been hit very hard with this coronavirus situation, and we've been advising them of local business grants that they can access. So we've been advising them on that. And like Councillor Afzal, my colleague, has said that the food banks were a big take-up of a lot of the residents in our ward, and we've had a lot of support from a lot of the organisations with providing not only food but other items, household items, which I know a lot of the elderly have been suffering. Like I know a family that never had a gas cooker that broke down. It was an elderly person, that gentleman that was living alone, and they went out on a day that he rang, and he rang up to say thank you. So I do know some organisations that have been working like that. Also, can I also say thank you for Colin and Mark, that have been chairs of a very active resident associations, and they've both
Yes.
been
We definitely missed those meetings.
We've had both Colin, the chair of Aston Residents Perry Aston Residents Association, and Mark was from Aston Residents Association. We've missed having the meetings, face-to-face meetings in our associations, and hopefully moving positively, we hope we do get some meetings in soon, but you have been greatly missed, and the tremendous work that both chairs do with ourselves and the residents in Aston. So with that, I think that's all for tonight, and I don't think Councillor Afzal has to say anything, but I'd like to say just keep well and safe, and you've got our contact details if you need to contact us. Thank you, and take care.